So, welcome, Georgia. It's fantastic to have you jumping on to a Zoom meeting with me today about your experience in the gentle scar therapy program.
Happy to be here.
Great. So, what I'll get you to do is introduce yourself and your business name and where you're located.
Okay. I'm Georgia Tilley. My business is Harmony in Health and Nature. I'm in Mildura, Victoria, which is the top western corner of Victoria. It's quite a remote area. So I'm a remedial massage therapist, which I gained in 2020. Before that, I was in IT, so a very different world. Then I got my lymphedema therapist qualification in 2023. In 2024, I did oncology massage modules 1 and 2. As a result of that, I decided I needed to do the gentle scar therapy training. It was mentioned by some of the students in the oncology course how good it was and how well it fits in with the oncology and also the lymphedema work. And I am certainly finding that myself now.
Yeah, that's great. It's such a rewarding area that you work in, Georgia. You know, the oncology, the lymphatics, and now with the scars, they all just dovetail together, don't they? So, talking about, your clients, your beautiful clients, what advantage has your scar knowledge and techniques had with your current client base?
Well, for me, for a start, it helps me with my assessment. It's given me a greater depth of insight into scarring and how it can affect the body. And that's really helped me understand that how important it is to deal with scars when you're trying to fix someone's edema or help them manage their edema, help them manage their mobility issues. Scars are just another aspect to consider. And having done the course, it helps highlight for me that that is an issue I need to ask them about. Because a lot of times scars are in places where you can't immediately see either. So, for that reason, it's really helped me. For my clients, I'm getting marvelous feedback. Most of them can't wait for me to have a go at working on their scars. I've done a lot of work with, and this is just since undertaking the course, during the course, and after. I've done a lot of breast reconstruction scar therapy work, which has been really, really successful. Softening it up, making it look more natural, been feeling a little bit tired, a little bit pulling for people, or like they're getting a little bit of swelling in that area. Working on that has really helped. Same with the radiation scarring. I mean, obviously, it does make a difference to holding on to fluid and trying to get those pathways for the lymphatic to move through, when it's got all that scar tissue to go through. So yeah, the paddy pores, particularly on the radiation scarring, is really effective. Actually, day before yesterday, I had a 6-year-old girl come in too, and she had a scar she had an injury on her lip, where she'd fallen and taken a chunk out of her lip, and she'd had 2 surgeries on it. Her mum is actually my chiropractor, and she knew that I was doing this scar therapy course. And she said, "Oh, is there anything you think you could do for my little girl?" And I said, "Well," she said, "most of the scarring is inside the lip." And when I was doing the course with you, I saw that you were doing some intraoral stuff. And I thought, oh, what are the chances? I probably wouldn't, ever need to do that. So I'll, put that training for down the track a bit. So I haven't done the intraoral training. So I said this to the my chiropractor friend. I said, I haven't done the intraoral training, but she's a chiropractor. She's got really good sensitivity of touch, that sort of thing. So I had her come in with her daughter, and I did some work on the outside part of the scar on her lip, and the picking up the pin and a little bit of stroking, which when we could get her to sit still. She's 6 years old, so she was fairly she just wanted to bounce around. But then I sort of explained to her mum what I was doing, and she said, well, what I'm going to have a go at doing is when she's going to sleep at night, is to do the stroking and do the picking up the pin inside the mouth, etc., for her. And she sent me a text after her first night of it, and she said she did about 15 minutes on it, and she said she was amazed at how soft, and how it doesn't seem to be pulling as much in the lip. So that was just so
Oh,
good to hear. Yeah.
oh, so good. And how amazing as well. It is just so reproducible, I think, the
Mm.
technique. And it's like you learn that from me and pass that on to a concerned mum who has touch skills. Yeah. Yeah, brilliant. how,
Yeah,
how wonderful.
it's
What a
wonderful.
wonderful result. Yeah.
Yeah,
Sure, that
absolutely.
chiropractor will send you more people, Georgia. No doubt
Yes,
in my
she
mind.
does actually send me a few for lymphedema already. So yeah, it's a good system.
It's just gonna increase that. It's just gonna
Yeah.
increase that. You're gonna get spinal fusions, you're gonna get all sorts. Yeah, that's fantastic. You obviously managed to learn practical skill online with the videos and the program, the way it's set up. What would you say to other people that are a bit skeptical? Were you skeptical coming in that you could learn hands-on online?
No, no, because of what I'd done with the oncology massage global, I think, yeah,
Yeah.
OMG, yeah, that it was same sort of format with them. There was videos and then the weekly Zoom meeting, and I really enjoyed that. And honestly, it makes it more affordable for me too, just practicality wise, because I'm so in such an isolated area. It's hard to be able to afford the time and the money to travel to courses. So it was just perfect being online. And the videos, especially because like I've revisited them 2 or 3 times since the training as well. For example, the I have a client who's got swelling issues, but a lot of it is related to stress. She's a aged care nurse, and she has a lot of stress in her job. And so a lot of what we do is trying to manage that. Oh, the video on it was a YouTube link to the trembling.
Yeah, the
Um,
TRE, the TRE.
yeah, yeah. I had a look through that and I thought, yeah, I think that might be really good for her. So I sent her that link to have a try of as well, and she's just over the moon. It's really helped her. So and then just refreshing my mind on when I know I've got a client coming in for something in particular. I saw that in that video, so I just go back and have another look first. Yeah.
Nice, that's great. So we've kind of gone into like little parts and bits and pieces of what the format of the online learning program. I'm curious to know what your experience was, but first of all, can you perhaps say what the best bit for you might have been? What did you enjoy the most, Georgia?
Probably, yeah, I think the videos and the just how well rounded it was, so that I can go back, and having the manual too. Like I've printed that out, and the only thing with the manual was I was having trouble finding the bits that I wanted each time. So I created a table of contents for it,
Oh,
so I can flip
nice.
through to where I need to go, which is really helpful. So I use that a fair bit too.
Oh,
Um, and that's what I'm saying. The videos, links to other techniques, and associated issues like the trauma, and having the printouts as well. It was just so well rounded. So being able to access all that ongoing, yeah, I can't really pick one thing in particular
That's
that's my
okay.
best, my favorite. I loved it all. And the Zoom, weekly meetings were quite good too, especially hearing other people's journeys and how they're going with it. Yeah.
Yeah, it's nice to know that you're not alone, and
Mm,
maybe it comes up for one person in week 2 might come up for you in week 6, and everyone's kind of a little bit different as to their experience and also their pre-existing knowledge coming into the program as well. So we try to
mm,
cater for a set level, which is why we speak to everyone beforehand, but different people coming in from maybe an oncology background and somebody else is coming in from pregnancy background. You know, we all have slightly different, somebody else might have a big focus on the elderly or burns or young children or whoever. The interesting thing is they all have scars and they're all
mm.
affected at the basic level in very similar ways. So their fascia and lymph and nerves and psychology and emotion can all be impacted. So yeah,
Yeah, yeah, and you go through all that in the course, so yeah, it's very well rounded.
oh, great. Glad you liked it. In terms of the presentation, we do a lovely presentation at the end of the, well, throughout, and then it's presented at the end to your peers. What was that experience like for you?
Really good. Really good. It helps you focus on, or helps me focus on things that I otherwise might just, try to glide over because, oh yeah, I'm more interested in this. If you know you've got to do a presentation and you know you've got to cover off on certain things, then it makes you pay more attention to what to the learning material. And well, I've been studying for the last 20 years non-stop, pretty much doing my IT degree part-time and all that sort of stuff. So I kind of work well with that, having an assessment style um, study, because it just makes me focus.
Yeah, no, that's great. Do you think about scars differently now than you did previously?
Oh, hell yes. Yeah, it's kind of like the lymphatic system. I was kind of like the rest of the world before I did all my training, and you don't even think about it really. You don't realize how an important part it is of your whole body, and the same sort of thing with scars. When you've got a scar, it's impactful. I hadn't really given it much thought before until I started doing the work with the oncology clients and people with scar issues. And like some scars that I have seen, they're Mildura is a horticultural area,
Mm.
and it's also a place where we have lots of motorsports as well. So I've seen, scars as a result of equipment, machinery, sporting accidents, yeah, that are quite horrendous. And it's nice to know that I can help people with that now as well, not just for the oncology, but for all the other stuff too. So, as far as I know, like there's no one else in Mildura that's done the gentle scar therapy. I've sort of done a bit of a Google search to see if there is. There's physios who will work on scarring, but they tend to, like I have a catch up with some lymphedema physios here, and they're all about the cross fiber friction and all that sort of stuff. It's a very different style.
Yeah.
So I will be putting some detail on my website about it all, but I'm not going to actively market it because I didn't really do the course because I wanted more income, and more clients. I'm happy with the number of clients I already see. I wasn't trying to get more in the door. I just wanted to be able to provide a better all-round service for those that I'm already seeing. So yeah, I want to help people, but I don't want to do it to the detriment of myself as well. So I don't want to overwork myself.
That was amazing. So you were just saying about how it's really about increasing your knowledge to increase the quality of care that you're providing to the people you're already seeing,
Yeah.
which which I absolutely love.
And
It's
it
really
makes me feel better about, because it's, I am a little bit selfish. I'm doing it for me. It makes me feel better, when I can really effectively help someone. Is just that feel good thing.
yeah,
Yeah.
absolutely. I mean, why not love what you do even more? You know what I
Yeah,
mean? I mean, why not? And if providing a higher level of treatment is going to do it, then I'm all for that. I'm all for that. I love that. That's kind of why I work
absolutely.
as well.
Yeah.
Became
Yeah.
completely obsessed with scars and, you know, how did this happen and how can I learn this and what's actually going on and all of those amazing questions that
And I love that other people can benefit from what you've learnt because you're training people in what you've learnt. It's wonderful, and you're giving us all your citations of what you've learnt and where it's come from too, and that matters as well. It really does. So yeah, I'm very appreciative of that. We're very fortunate to have had you.
thank you. Thank you. That's really kind. If someone came to you and said, "What's this training like, Georgia? Should I do it?" What would you say? Like for another
Oh,
therapy?
hell yeah. Yeah, absolutely. Of course you would. Yeah, that's right. Better if we had more people. Like I said, I know that there's more people that I could help, but I'm looking
One
after myself
person.
as well.
I'm
That's why
one
I'm not.
person. Yes,
Yeah,
exactly.
that's right.
That.
So it'd be lovely if we could have more therapists that have done the training. Like I am sort of suggesting to the physios that I do a catch up with that, this is great. You should do this. Yeah.
Which would be
Yep.
one as well. Yeah.
Mm.
I have had a couple of chiropractors come in, a couple of osteos, and a couple of physios so far, but mainly it's the massage therapists who are
Yeah.
just embracing this full heartedly. They're just like, oh wow, this helps my hands. I think is the first thing for many people. They're like, I'm just looking for something to prolong my career so I can just keep doing what I love doing and help my clients. So I guess it really speaks to the heart of massage therapists in a way. But it won't be long. It won't be long until all the chiros and all of those guys, physios come in and, you know,
Yeah. Yeah.
get that.
Well, even like I have a bit to do with the hospital here too for the oncology work as well. So, even the wounds nurses and all that sort of stuff,
Yeah.
they could benefit from it too. It's just whether their time and funding and all that sort of stuff allows them to, because they work in the public service. I don't really know how
And that works. Yeah.
that would work. Yeah. It
And
tends to be more private practices, I would think. Yeah.
so far it has been private practice is the thing as well. Um, I'm a bit curious about your perspective on scars from a lymphatic therapist point of view. I know that you've got the oncology as well, but from lymphatics therapist point of view, do you find it beneficial when you're treating anyone who has scars from lymphatic surgeries? What's your take on that?
Yes, absolutely. My confidence for a start, because they did discuss scars when we did the lymphedema training, but we didn't do anything about, working on them. It was more about how to sweep the fluid around the scar and find a new pathway. But
Oh,
if you can soften the scar tissue, and like you said, it's the iceberg. There's just what you see on the top is nothing compared to what's below a lot of the time. Um, so yeah, knowing what I know now, I'm like, okay, we need to do your drainage, but if we want your drainage to be effective, we need to do something about this scar tissue that's right in your axilla area. It's blocking flow. It's going to affect stuff. So it's not only having the confidence to know what I'm talking about in that regard. But to be able to explain that to the client and have them understand, and then be able to implement the treatment that's a little bit of scar therapy, a little bit of lymphatic drainage, massage, and and I'm getting great results from it too. Yeah.
So good. Yeah, I'm really curious around the lymphatic stuff. I'm Casely Smith trained, and I have been using it for a long time in tandem with each other. I'm just now getting more and more people coming in going, I want to know about this for lymphatics, Christine. I'm like, oh, okay, cool. So, I mean, we do have lovely training on that. I'm just curious as to, someone who's already there and doing it, how it's been working. And it sounds like
Yeah.
it's going together well.
Absolutely. And what I'm doing now is so much more effective. Than before. I did just the lymphatics, and I was kind of, unsure about what to do about scars. Or do I go around this one on this side or that side, or, but I wasn't doing anything with the scar. So there was still that blockage there, because they don't actually, or when, because I did Casely Smith too, they don't actually, they mention about scars, but they don't actually teach you how to, treat them. Certainly not any in-depth information about the effect on fascia and all that sort of stuff. Fascia is discussed, but it's just not comprehensive. You need to do your course to be able to put it all together. Like, to my mind, because so many of the lymphedema people that you're seeing, they've got lymphedema because of an accident or something that's happened, and there's most of the time there's some scarring involved as well. So I think anyone who's done the lymphatic course should also do the gentle scar therapy course, because it just makes the lymphatic work so much more effective.
Yeah, cool. That's
Yeah.
awesome. Is there anything else at all that you'd like to say before we finish up our lovely chat together?
No, other than just a big thank you to you and your
Oh,
team. It's been wonderful.
right. That's fantastic. I will pass it on to them and let them all know how much you enjoyed it, Georgia. And
Thank you. I really appreciate the marketing material too. That's going to save me a lot with my website work. So yeah, I
oh,
really appreciate
good.
that too.
Oh, that's fantastic as well. I don't know if you know, but there is a little webinar coming up for grads on marketing for your new modalities. So come along to that if you can.
Okay.
I'm sure there'll be a recording if you can't. But it is just for our graduates. So to help
Yep.
you guys to, just get there faster with
Thanks,
getting out
Christine.
what you do. Yeah. Brilliant. All right then, Georgia, that's absolutely fantastic. Thank you so much. And keep in touch. And any, future success stories you want to share, just reach out and let us know.
Okay, will do. Thanks, Christine.
Thanks so much, Georgia.